Okay. Can you hear me? I think I messed up my. Okay. Let me try my screen
We
share one
hear
more
you.
time.
Thank you, everyone, for your patience. We are going to get started truly in just a second. Welcome.
Okay. All right. Good afternoon, everyone. Sorry for the technical difficulties. And welcome to my presentation today on supporting wellness and employment for youth with marginalized racial identities. My name is Abir Sikder. I'm a senior policy analyst for the Council of State Governments. I'm a Bengali American man, brown skinned, wearing glasses with black hair, wearing a red and white shirt. And again, I'm a senior policy analyst for the Council of State Governments. I work on the education and workforce team. Specifically, my focus is a project called Cape Youth, and I'll talk about that. My areas of focus are youth and disability policy, mental health, equity, justice involved youth, DEI in the workforce, and intersectionality. And before my time at CSG, I was a student at GW Law School. Never actually practiced law though, or took the bar. Don't tell my mom that. I'm just kidding. She knows. And before that, I was a public interest law student there. Before that, I was a teacher in Teach for America, taught math in Memphis, Tennessee, for a couple of years. And I think that really informs a lot of my background in working with students, particularly students of color and students with mental health concerns and special ed students as well. And then before that, I graduated from the University of Louisville with a bachelor's degree in economics. Normally, I'd have my colleague Adine Carhan presenting with me, but she wasn't available today. But let me talk about Cape Youth, the project I'm presenting on behalf of today. We're a partnership between the U.S. Department of Labor's Office of Disability Employment Policy, known as ODEP for short. There are federal grant funders. CSG, where I worked, as I mentioned, we're located in Lexington, Kentucky, but we have regional offices across the country. We're the nation's only nonpartisan organization that serves all three branches of state government across all 50 states and the four territories and districts. And I see us as kind of like a mini UN of the 50 state governments, sort of. And yeah, we work across all areas of public policy. But again, I'm specifically on the education and workforce team on the Cape Youth Project. And for Cape Youth, our partners are the Yang Tan Institute at Cornell University. They kind of give a lot of the academic research, and that's the Yang Tan Institute on Employment and Disability. So what Cape Youth does, we seek to improve employment outcomes for youth and young adults with disabilities by helping states build their capacity in youth service delivery and workforce systems. We focus on increasing capacity for strategic partnerships and system coordinations, work-based learning, and professional development as well. And we do our work, we do this by conducting research on new and existing innovative policies and practices through research briefs, through blogs, through webinars, through events, through reports. We develop strategic partnerships. For example, we have state exchanges where we bring together state leaders, that's policymakers, elected officials, executives, administrators, and also practitioners, subject matter experts, youth themselves, to help them develop partnerships. We share best practices among key stakeholders. So we kind of say, for example, hey, what are things that Louisiana is doing that Kentucky can learn? What are things Kentucky is doing that Louisiana can learn, to share best practices among different states, state agencies, and localities as well. And we help states identify new opportunities for new programs and services. Now, to focus on today's topic, a little bit of background of how this started. We ended Cape Youth entered into a partnership with the White House Office of Public Engagement to hold a couple of virtual discussion roundtables. We had our first one on justice involved youth, and then we had our second one, which I'll be talking about today, back in September. It was on improving mental health service delivery for youth and young adults with marginalized racial identities. We came together on that topic because the White House wanted to talk about the different struggles that BIPOC communities, particularly Asian and Black and Brown communities, have faced during the pandemic. I'm sure we all know of various Black Lives Matter protests, the discrimination Asian Americans faced during COVID, things like that. And then also at the same time, our Department of Labor colleagues at ODEP, and then ODEP specifically, but also Department of Labor overall, last year and still this year are leading a really great mental health at work campaign. And I think, as we all know, mental health has come to the forefront of workforce service delivery. Thinking about your employees' mental health needs, addressing that, and also come to the forefront of addressing the needs for youth in school as they prepare for the workforce, and just for their overall well-being and health. But all that came together. ODEP's idea for the mental health focus, the White House's idea for talking about BIPOC communities to discuss this topic. And we're going to tie it, of course, all into education and workforce development per Cape Youth's focus. But for this roundtable, we brought together policymakers, practitioners, elected officials, youth and young adults with lived mental health conditions as well and lived experience. Brought them together, had some presentations, and we had some breakout room discussions on barriers to mental health access, mental health in educational and school settings, and also the importance, the overlap of mental health and employment as well. Discussed those, and we had stakeholders from departments of labor, education, youth services, mental health, public health, HHS, juvenile justice, general public benefits, departments of economic development. We kind of go all across the board. When we think about education and workforce development, that kind of includes everything. And on the converse, mental health overlaps with all of that as well. So we brought together basically as many stakeholders as we can for these discussions. And these are people on the federal, state, and local level. And then this day, I'll be focusing on today some presentations we had on youth employment programs and mental health from an equity perspective. And if time allows, I'll try to bring up some key points we had from that discussion roundtable, but we'll see if we have time for that. So first that day, I want to talk about a report done by the National Youth Employment Coalition. They were also one of our partners for this work we're doing and for this roundtable we held. They have the report on this topic right here, identifying gaps in youth employment programs' capacity to address mental health needs.
Abir,
Yes.
sorry, can I interrupt you very briefly?
Yes.
I just want to say the screen that you're sharing might not be the one you're intending to share. We're still on the opening slide.
Oh, okay. Mine. Let me see. Let me start the sharing again.
Hey, there we go.
Oh, is it good now?
Sorry, no, not yet.
So when I click, okay, present to audience, share screen, I
Mhm.
just click the window of like that PowerPoint. Is that the correct?
Um, you press shares, present to audience.
Mm-hmm.
Yes, and then you click on the one that you would like, and
Yeah.
then once you're in there, go to slideshow.
Yeah. Okay. Let me just try that again then. All right. So I'm sharing that from
Yeah.
current slide. Okay. Can you guys see identifying gaps in youth employment programs?
We see that, but we also see your notes and the upcoming
Oh,
slides. So if you go to
so,
presenter mode
okay. In here.
in PowerPoint, or go down to where there's the little like podium on the bottom right hand
Yeah.
side.
This.
Hmm.
Okay. I mean, I have it. Okay. Is it good now? Is it a regular slideshow?
No.
Okay. I'm still seeing like I'm just seeing the full slide. I'm not seeing my notes.
Oh, huh. Okay.
Let me try to share entire screen maybe because maybe that's
Yes, they're suggesting share the entire screen.
okay. All right, let me go to my PowerPoint. Be from current slide. Okay, now is it showing an entire screen identifying gaps
Beautiful.
in youth?
It is.
Okay,
Yes.
perfect.
Lovely. Thank you.
And I just changed slide. Do you all see the full slide of survey response base?
Everything. Yeah, we see
Okay,
exactly. Yeah.
perfect. So I'll go
Thank
back one
you.
slide. Oh, sorry about that. Thank you.
No.
But yeah, I'll talk about this report, and just to give some background on NYUC, the National Youth Employment Coalition, their focus is on supporting disconnected and opportunity youth, and by that we mean young people who are out of school, out of work. Thinking about that, like obviously, if you're out of school, not getting your education, out of work, not being able to get a job, but it also affects just your community connections, your network. Sometimes school and work are the places where you get certain benefits, mental health needs. Even for young kids, sometimes it's maybe the only place they even get their nutrition or food. And they do a lot of advocacy and policy work in both the workforce and employment space and also in the youth advocacy space as well. Um, I'll skip this part. But overall, with this report, it talks about how before the pandemic, we saw that millions of youth and young adults were experiencing stress, trauma, anxiety, and heightened levels of depression. And the COVID-19 pandemic exacerbated these conditions among all of youth and young adults and really, established an unprecedented mental health crisis across the country. And I think we're still seeing the effects of that, even if we're in the so-called, post-pandemic end of COVID era. And these weren't just exacerbated. I mean, they were exacerbated for the entire population, really, for all youth, but they were even like hyper exacerbated for communities of color, LGBTQ individuals, people with disabilities, immigrant communities, people with eating disorders, healthcare workers and frontline workers, of course, kind of any marginalized community you can think of, they were even more negatively infected by this. And we saw rates of depression triple, in fact, compared during after the pandemic and during compared to 2019. So this report talks about that a bit, but it was published in 2022. So most of the data they talk about is information, during that pandemic era of 2021 and 2022 itself, and looking at that. So it talks about young adults overall, and I'll highlight that, and I'll highlight some of the particular aspects for a community of color. But for the survey they did for that report, which is linked here, they surveyed over 563 organizations across 49 different states. And overall, that represents about 330,000 youth and young adults. And by that, we mean people aged 16 to 24, which is and that number, they got that from the combined amount of young people that these organizations, these numbers here, of all the youth they serve across the country. And here's a breakdown of the types of organizations. And of course, the importance of this is that workforce providers are often on the front line for observing and addressing their employees' mental health needs. And it's particularly important to think about youth and young adults who are entering the workforce to have something set in place for when they enter the workforce. Here's mental health supports we have in place, and here are things we can, have to support you as you, continue to develop, get promoted, do new jobs, transition throughout various parts, go from school to the workforce, things like that. And just these programs just frequently observe, they're on the front lines of observing youth mental health concerns, which affects their ability to obtain employment, to retain employment, and to just obviously have positive health outcomes. Here I'll go through a couple key findings from that report, and this data again is broken down in more detail in the actual report. But they found that 64% of respondents indicated that they did not have any kind of screening process in place for monitoring a young person's mental health needs. And when I say like any kind of screening process, like they didn't even, this is the majority did not even have something informal. Just doesn't have to be something that an expert, a mental health worker was doing, just even a basic 1 or 2 question questionnaire. Most didn't have that. 70% of the respondents don't track who gets services. So that's things like making a referral, and just even like handing them a card to call a therapist, even basics like that. They don't often track. It's important, to make those calls and connect youth to those services, because sometimes the workplace, your job may be the only place or one of the few places where you have access to that. And this ties back to the first bullet, but for those who did not have a screening process, 60% of respondents estimated that over 50% of their youth had mental health needs. Just concerns they had about that. 60% of respondents indicated that less than half of the youth can access mental health services when they need them. I think it's important to consider that even when you have things in place theoretically, you have to think about the timing and when they're available. And then almost 90% of respondents indicated that they did not have sufficient resources to deliver quality mental health training to staff. And that's even things just like as simple as mental health first aid, and just generally knowing like who to ask to talk to if you want to report a concern for yourself or for a fellow employee or coworker. And then next, they surveyed among those over 500 programs, organizations surveyed. They talked about the common mental health conditions encountered. So these are like just reporting what these programs saw. The most common by far were anxiety and depression. As I mentioned, depression, I mean, I guess both really, but depression in particular, rates have tripled across the youth population, but among, again, BIPOC communities, immigrant communities, LGBTQ, people with disabilities, it's been shown to be even higher. There was a high degree of behavioral disorders, high degree of substance use, general trauma, PTSD, OCD, and then the others like other forms of trauma, like secondary and vicarious trauma, different kinds of emotional abuse, general stress. And you'll notice this doesn't add up to 100 because a lot of people, these are overlapping conditions they have. You can, of course, have anxiety and depression and a disorder. Sadly, you can even have all of these. And next, I have some of the key takeaways that they had for both stress factors and barriers to help. So part of this survey, I talked about how they surveyed the employment programs and the workforce providers of different organizations. This part, they actually had youth focus groups where they talked to some of the youth who were being served by those programs. And these are youth, represented across the country. Again, those organizations represented 49 different states. I don't know that they were able to get youth from all those 49 states, but they were, regionally varied. They listed some of the big stress factors and barriers to help. And here are those. The biggest stress factor was just the pandemic and general isolation itself. Of like the loneliness that came with the pandemic. Losing that sense of belonging, which school and work environments are an important place for that. Just academic and school stress, finances, family trouble, employment, relationships, and that's familial and personal and romantic and all those and friend ones, and then just general health. And then the barriers to help they saw were just general cultural barriers, stigma around mental health, availability of professional help, transportation to services, and then lack of financial ability to pay for these services. And the first two there on barriers, cultural barriers and stigma, there's a lot of data that shows that those are even exacerbated even more for BIPOC communities in particular. And again, me working on the education and workforce team, we try to focus on how going to school is a positive outcome. Getting an education is a positive outcome. The work, getting a job, workforce development is a positive thing. But we also want to think about kids and young people get stressed in school. It's a stressful time, from bullying to worrying about tests. I mean, I was a teacher. I was stressed as a teacher myself, stressed for my students. And same thing with employment. You get stressed from that. You worry about your boss getting fired. And so we want to think about, unfortunately, school, education, workforce, and education and employment can be the problem sometimes. But with our work, looking at how they can, focus on how they can be the solution. And so on the last two slides, I talked mostly about, the problems and challenges. I see this information as kind of the answers, the solutions to what we discussed. So you'll see that reflective of the concerns that were brought up. But they had the respondents to the survey they did, rank the type of supports and the resources that they thought would just be most helpful for their workforce or employment or whatever program they were doing. So they have those ranked here. Number one was just general staff training on screening assessments. Nothing fancy or detailed, just like basic certifications. I know at CSG, I know my manager done it, but I think all our managers, they do a couple hours of like a mental health training, just to help them know the basics of when to know, someone you manage or a fellow coworker, when to know if you may want to be concerned about a mental health struggle they're facing, and how to talk to them about it, or talk to someone about it. But it's meant to be a helpful thing, but that's just a basic example. But going off that, number two was an in-house clinician. So here we're talking about a mental health expert, a social worker, maybe a counselor, and maybe more than one of those. But you want an expert, and ideally that ideally have in your workplace or your office, or that you can refer to at least, close by in a sense. But that they could, of course, deal with the more the more serious mental health needs and conditions, the more intense ones, because you wouldn't want to put all that on the staff, obviously. Number three was flex funding for transportation and other basic needs. That's just pretty straightforward. Hey, here's some money for your needs. Kind of a personal example of that for Cape Youth, we have our own youth advisory group. It's 9 youth and young adults with disabilities, all age 16 to 24, all in high school or college. One's in law school, but the rest are in high school or college. But just for example, when we bring them, sometimes they'll come with me and present on these events virtually with me or in person. When we bring them to our events, our working group state exchange to advise our policymakers, we give them a paycheck, and we also, we cover a lot of their meals and travel. Then we say, oh, by the way, here's some flex funding. Here's just some money just to help if you have extra needs or meals or an emergency. We just say, for young people in particular, particularly those with disabilities, those of color, again, just it helps to have money. You never know what comes up to address those needs. And then number four was better access to local mental health services. So again, just thinking about what's there locally, what's available in your community, making partnerships there, making partnerships there, and just referrals there, just seeing who's around. Number five was staff training for working with cultural barriers. I mentioned the staff training for basic screening and assessments, and this is more focused on sort of DEI, DEIA initiatives, sort of thinking about that, looking at cultural barriers. As I mentioned, stigma being an issue, and different cultural barriers that may prevent someone from trying to access mental health services at work, or just not knowing how to, just the uncomfortableness, or just feeling even workplace culture being an issue there. And of course, I think number five is particularly important for minority communities. So number 6 was better screening tools. Again, just like a lot of most of them, that number I think was 64% did not have some kind of screening tool in place, basically, but just something basic. I mean, like questionnaires to things experts can develop. I know Mental Health America. I'll share some other stuff later, but they actually have their own screening tool that just like a basic thing anyone can use to identify a mental health condition. Number 7 was staffing and overcoming stigma in pure mental health services. Similar number 5, I think this one's particularly important for BIPOC communities because, like, sometimes it is there, the supports are there, services are there. It's just the stigma that comes with, like having to label yourself as having a mental health need, or just the fear, or even just the awkwardness of not knowing the way mental health is defined, things like that. And I think with this one, we again with COVID, I think one of the positive aspects of COVID was that mental health came to the forefront. I think nationally, statewide, locally, communities in general are more supportive of like being open about their own mental health needs, about helping people with mental health at work. I mean, think of like young populations. I mean, again, working in youth policy, we see TikTok videos sometimes, and like just young people are open about like their mental health needs. Again, like the Department of Labor has mental health at work campaign where they bring in managers, HR staff, employees, employers, interns, to just they themselves will talk about like mental health needs they've had, examples where they've been able to talk with someone, stories where things haven't worked out. But I think there's just more of an openness on this. So I think that training, this is like a good time for that training, and there's still issues with stigma, still issues with the fear, but I think we're having a really good national movement here. And number 8 was supports for staff who experience vicarious trauma working with youth. And this vicarious trauma is like secondary trauma. It's just when you work with someone like a young person, who's suffering, who's has a serious mental health condition, a young person in foster care, for example. I mean, just struggling. This is a thing we saw with frontline workers as well. Doctors, nurses, medical staff having to deal with people who had serious bouts of COVID or other health concerns. You see that trauma they face, that their family faces with that, unfortunate deaths and suffering. That trauma, that affects you too, and it causes a secondary trauma you face. Um, and I remember as a teacher, I don't know if I would exactly call it trauma. I think that may be extreme for my scenario, but being a teacher, I taught in one of the poorest neighborhoods in Memphis, Tennessee, a Title I school. And my students, and the majority, 99% of my students were Black and brown. And just like hearing their stories, like that affected me too. It made me depressed. It made it harder for me to work. Like decide like, hey, why aren't you doing your math homework? Work on this test. And they're like, oh, I had a family member die, or oh, I don't have a home right now, or oh, hey, I'm unfortunately facing violence at my home or from family even. Just like I'm like, oh yeah, I get. Well, like I'm here to be your math teacher, but I get why you're not focused on this lame assignment. That it's important, but like you have bigger fish to fry, and that caused me to struggle, to be depressed around that. And I had to really think about, you know, being more culturally responsive and inclusive. And it was tough, having to kind of be a teacher. And, as I mentioned, you want to have general screening for staff and have an expert in-house clinician, but it was kind of expected from me as a teacher, and probably teachers across the country, to kind of unfortunately be that expert in various things, not just helping your students with mental health and home stuff, but yeah. So I think 2 questions I want people in the audience to think about, and you can feel free to share in the chat, and we can jump back to these questions if we have time, are what are steps that workforce partners can take to forge relationships with providers? And I'll pause there while people think about that and reflect on it. And then the second one here is, how can states connect more youth and young adults with disabilities, and just youth and young adults in general, who are experiencing mental health conditions, to vocational rehabilitation and to other workforce systems, particularly when their symptoms impact employment? So I'll pause there for a sec, for people to think about that. And then some examples I have here, forging these relationships of connections. I mean, looking again at mental health departments, looking at local mental health organizations, healthcare centers. I mean, universities and even community colleges have like healthcare programs. They may have, notable research centers too that work on this. Even national associations like NTACT, of course, the American Psychological Association, and also workforce programs as well, like the National Association of Workforce Boards. I mean, workforce programs, of course, care about or they're supposed to care about, or have to pretend to care about the mental health of their workers and people. So, working with both national health and mental health organizations, while at the same time working with employment and workforce development organizations on a national and state level as well. When thinking about youth and young adults, again, we want to think about best practices. I think peer counseling and mentorship. Mentoring has been shown to be a best practice for young people. I've been fortunate to have mentors throughout my whole life, both like formal mentors through programming and informal mentors, and even just close friends who are my age, people who are younger than me. Um, um, but having that, and then I've also been lucky to be in mentoring programs as well because I've learned to guide young people. That doesn't have to be, with young people, like mentorship is important, but it doesn't have to be someone who's necessarily much older. Be someone again younger. I mean, my manager is like 7 years younger than me, and she's the wisest person I know. Um, um, but she's a mentor to me, for example. Also looking at family centers, family programs and community centers, of course, that can have these or can develop these. And also more specific policy considerations are appointing mental health leaders and providers to local workforce boards, or to youth committees, or even just starting youth committees, having a mental health person on a youth committee, or making mental health important role, having an important role to play for a youth committee. Um, um, Creating either youth and or mental health task force that are comprised of youth themselves with these experiences of workforce partners, private sector employers, government people, mental health professionals, healthcare professionals, and then ideally including someone who's experienced with the BIPOC community, a DEIA professional, enough youth of color, more specific with that. And then just DEI and DEIA programming is an important thing as well. And you also want to think about data, having data that's broad, but also like data that tells a story, looking at specific data that's broken down by race, by gender, by disability, by different types of disability, by rural and urban. Because there's often like there's universal concerns with mental health across all those, but also there's unique ways it impacts whatever community you're looking at based on identity, geography, various factors. So that first part of my presentation focused on mental health and the employment aspect of NYAC's work. Now I'm going to talk about mental health from an equity perspective, and I'll share some of the work from our colleagues at Mental Health America who are part of the event I mentioned. And Mental Health America, they're an organization that basically just does that, mental health in America, and they have programming for BIPOC, for youth, for employment, for school, kind of every aspect you can think of. And this part of the presentation will be focused a bit more on the BIPOC community. But overall, in the midst of the pandemic, research highlighted vast differences between groups in terms of access, and also in diagnosis and treatment for mental health. So here we have some broad data from Mental Health America. They show that over 1 in 10 youth in the country are experiencing depression that is severely impairing their ability to function at school or work, at home, or with family in their social life. I mean, if anyone knows anything about mental health and depression or any kind of expertise with the youth, like it's obviously higher than this. This is just data that's mostly self-reported. When you're thinking about a young person, they don't know what depression is sometimes or how to properly define it. A question I was asking myself a lot over the pandemic, honestly, is, oh, am I depressed right now, or am I suffering from severe depression? So asking a young person to do that, it's just hard to self-report. And then of that 1 in 10, and again, like that's self-reporting. Actual other data out there suggests it's much higher. And again, it's exacerbated higher for BIPOC communities. And of that 1 in 10, 60% of these youth do not receive any mental health treatment. So thinking about that, and when this mental health, when it impacts their ability to function, that's saying only 4 out of those 10 actually receive treatment for the symptoms they have, meaning that there is 20% or more are not accessing treatment than those that are. And now considering that these groups of those who are effectively reporting and receiving some form of treatment, only slightly more than a quarter of them, 20%, receive consistent care. So some do receive the care, but you need to think about mental health conditions. You need to have consistent care. I mean, something that affected you when you were young can affect you years later. It can affect you your whole life, whether a mental health condition or traumatic experience, and so on. And overall, we saw, there are discrepancies in youth of color, higher depression, particularly among Native American, Black youth, and then also multiracial youth. All those groups are more likely to receive non-specialty mental health services in educational settings. And we see these, higher rates of mental health concerns in under-resourced school districts, which particularly for communities of color, in impoverished areas, places with high rates of trauma, like have recent school shootings, communities that have high rates of violence, um, um, and even domestic violence. I think it's important to think of how school is an important place. It's about more than just learning. It's about a place where you should feel safe and get your needs met, because that affects how you learn. Same thing with the workplace. Like a workplace, yes, it's there to do your work, to be productive, whatever, to make money, but it should also be a place where you feel safe, and that does make you more productive. And then, again, with the self-reporting, people just don't know the symptoms of anxiety or depression, or recognize they don't recognize symptoms. They don't see how the risky behaviors they're engaging in are responses to untreated trauma, to mental health conditions, to depression, or how they can exacerbate all those things. And that's not just true among the youth themselves reporting. I mean, adults, teachers, like we don't know how to do that. Employers don't know how to do that. Even experts have debates on, how to do that if something is affecting someone there. But I think, talking about the consistent care, you really want to make, I mean, kind of every setting, but schools and workplace in particular, you want to give them a place, make them a place of consistent care, and really give a sense of predictability, because that's really important. That stability, predictability, it's really important for young adults as they're transitioning to school, from school to the workforce, and just as they're going through adolescence. Here are just a few high level bullet points from Mental Health America's work as well. So I want everyone to think, kind of pause for a moment, and we do want to consider before I present this, like how we can sort some of the bias that accompanies data like this, because I think sometimes research has a tendency to like list the problems believed to be associated with certain groups in a way that may like perpetuate stigma rather than understanding. So you want to look at this, with more of a curiosity lens, with an open lens, ideally through a viewpoint of trauma informed care, and look at what systems can do and what equity gaps exist, that contribute to these concerns for specific racial groups or other marginalized groups who have higher rates of mental health conditions. So, just some I want to share are that Black adults are 20% more likely to report serious psychological distress than white adults. We see a lot about how, like in certain communities, there is higher rates of mental health concerns, higher stigma. This is here we're talking about reporting, but it's because often the research just chooses to focus on that. Like if you actually look at like white men too have serious psychological distress, it's just like not talked about or reported as much. But that's the first one. And interestingly enough, that's the case with Black adults, but Black youth are similarly to Black adults. They tend to have similarly higher rates of psychological distress than their white counterparts, but the reporting among youth is lower. And I think, part of that, again, they're young people, like they may not know how to report it, or like not even have a place to report it. But I think it's interesting that, like, while there isn't a correspondence there, like they're not as likely to report it, even though if the adult population they are. And of course, racial trauma and discrimination increases the risk, particularly for those with disabilities, but really for all youth and adults, for suffering from post-traumatic stress disorder. Again, we saw it a lot over the pandemic. I think, unfortunately, some people are still facing it. And then stress hormones can increase the risk for depression and anxiety as well. So I want everyone to just kind of think about that, think about they're associated with racial trauma and mental health, and really think about how you see these dynamics playing out within your organization, within your community, your state, among your policymakers, among your school, wherever you are. Just really think about this data. And I've linked to it here. Again, Mental Health America sources break it down a lot more. And so, kind of part of the solution here, some examples are what we call culturally based practices. These are culturally rooted customs, behaviors, values, and beliefs passed down through generations, and they can function as informal systems of support. I will disagree a bit with MHA here. It says informal there. I think these can be formal, of course. They can be built into a culture. They can be part of religious dogma, part of just they can even be part of a policy in a sense. But yeah, just wanted to note that I think they can be formal and informal myself, and at least from my cultural background, I've seen that. And overall, these practices form part of a socially dynamic framework of assistance that are provided to individuals by their families, by their friends, and by their communities. These examples I'll mention, they're from some of MHA's work, particularly in examining Native American and Indigenous communities. But I think these are things that can be applicable, or just have different names, but be the same thing in other communities as well, and not just communities of color, but like also kind of any community. But the first one is healing and prayer circles, where people come together to provide support and prayer and assistance to one another. The background on this, it's a I'll say a common practice among various indigenous communities, focus on communal bonding and assistance. And a key thing of it is like gathering in a space for comfort and healing. And we hear the term safe space a lot, but I think with this we want to think about like a sacred, non-judgmental space, because that will be the cultural religious belief that, hey, this isn't just a safe space; it's sacred. Like this is a holy place where we don't judge each other, where we all feel safe. And within the circle, there can be different kinds of things, from telling stories, sharing personal experiences, doing a religious prayer, breathing exercises, chanting, meditation, collective prayer. I think meditation is an interesting one. Like I heard a story once from someone who they were trying to, at their church, they were trying to have people like talk to people about doing more meditation. People were like, that's not like a Christian or a Bible thing. And they're like, do you pray? And they were like, yeah. And I'm like, that's meditation is a form of prayer / prayer for meditation. So I think with these, I want to highlight again just how, yes, there are examples we're pulling from certain communities, but I think they're all pretty, or at least somewhat universal. The second example we have are traditional healers and practitioners. Here we're talking about someone who's just culturally rooted in traditional knowledge to address the well-being of their people. Within cultural groups, these can be a variety of people with different roles, and it's often tough to label this one because it falls outside of the spectrum of the Western medical model. Um, but it can include people from like shamans to spiritualists, diviners, medicine men and women to herbalists as well. It can be people who are like kind of the medical roles in the community, but they have a cultural role as well. Number three is multi-general households. Here, just intentional practice where individuals of various generations in the family live in a shared space. We see this in certain Native communities. It's kind of, and then societies. Well, I've seen it in, I'm from Bangladesh, or my family's from Bangladesh, from South Asia. It's not uncommon in the South Asian community. I think in certain East Asian countries, this is a common one as well. But I think it's more focused on collectivist and communalist societies that sort of value familialism and emphasize that group unity cohesion over individualism. And I think a bit more in America, in the Western model, individualism is more focused, it's more dominant. And this of course can include households with grandparents, adult children, spouses, siblings, cousins, and offspring as well. I will note during COVID, during my last year of law school, I was staying with my parents because it was virtual because of COVID. And I was there with them, there with my grandmother, there with a lot of family. Not sure this one was. I think this one maybe caused more stress for me personally, but I think it can work. Next, we have kinship systems. And with these, we're talking about, reciprocal social relationships between individuals who may or may not be blood related. Just people like, for example, it's not uncommon for young people who've been in a foster home together after they leave that to like live together and still, maintain that relationship. And, in a sense, they've of course been a family raised together. I mean, I know this is a silly one, but these young TikTok influencers and stuff, like I think they buy houses in California and like they live together. They have a community of let's engage in digital media, social media, and these fun videos and dances. But I think that is a kinship system. People with related backgrounds who want to be friends. Um, Native communities, these kinship systems can be focused a lot on child rearing and childbearing communities, on and families as well too. The next one's pretty straightforward: just storytelling and oral traditions. Having the verbal nature to share things in a less formal way can really be more inclusive of a lot of people. And this can be invoked through spoken word, poetry, telling stories, folk tales, singing, performance arts as well. And the last one is energy healing, or sometimes called clearing, sometimes called cleansing. This is I think this one's the least the hardest one to grasp, maybe. And of course, the terminology differs between different Native communities and other communities as well. But it's kind of the belief in the interconnectedness between the individual, between their community, their environment, their networks, and looking at the energy, like sort of the ethereal, metaphysical energy focuses forces that impact their overall well-being. And some examples of how this is done are through sweat lodges, through things even like feng shui. If you've heard that term, about how you design a space to be more comfortable, and that can affect your mental health as well. I know we're at 2:50. If I need to pause or end or anything, let me let me know.
Why can I suggest just this, that you continue to the hour, and if
Okay.
people can stay, please do so. Uh, at the hour, the keynote will begin. And so if you do need to take a break, please do so. But also, please stay for this. This is incredibly powerful and important information. And regardless of if you stay or leave for a break before the keynote, please do fill out the evaluation, which is the 2 checks and the 2 lines on the side toolbar. So that's all I'll say. Then I hand it back over to you, Abir.
Thank you so much. I'll
Thank
kind
you.
of ask this question to the audience again. Feel free to share in the chat. We can discuss at the end if there's time. But what are examples of culture-rooted practices which can be woven into transition practices for young adults with disabilities in particular? And then number 2, kind of a related question: what are some unique or innovative ways that your states, your organizations, or your communities, your workplace, what are some unique or innovative ways that they are providing culturally mental health services? So with the second one, I think a lot about DEIA programming, emphasizing those in the community. And as I mentioned on that survey earlier, trying to have more culturally competent practices within the workplace and also with schools as well. These are things I want everyone to think about for that. And next, we have communities of care. This is an approach that's utilized by individuals to support one another. This one's kind of straightforward. It's just a general community. Can help respond to inequities and gaps within a place, within a community that is. They can also be critical in a person's mental health needs as they respond to isolating factors that people may experience that feel disconnected from their community, from their family life. Some example of that here we have our peer support. As I mentioned, I think peer support and mentoring is a best practice for young people, and it's been shown to even be more impactful for those with disabilities and those from BIPOC communities. We have community health. I'm going to these backwards. Sorry. Community health workers, thinking particularly about frontline workers who are, right at the front of serving people. Mutual aid opportunities, kind of voluntary reciprocal exchanges of resources for mutual benefit. I already mentioned healing circles. A more specific one we have here is doulas. They are trained professionals who provide continuous physical, emotional, and informational support to mothers before, during, and after their childbirth, and to kind of help them achieve, the healthiest, most satisfying experience and make the birthing process, like all satisfying and all that. And they can provide critical support to women, and it's particularly been shown to be really helpful to BIPOC communities, to women from BIPOC communities who are unfortunately at an increased risk of poor maternal and infant health outcomes. So that one's a bit more specific. But yeah, here are some of the policy briefs. They're linked here in the presentation. If you all can't access the presentation, I'm happy to email it to you. I'll share my information. So the topic I mentioned today, we're currently working on a policy brief. It'll talk about culturally competent care, mental health needs in educational settings, and then employment as a means of recovery, and focus particularly on youth from minority communities. But we're working on that right now, and we're doing hopefully one brief this year, and over the next year or two, we're going to have hoping to have a series of those. But we do have a general mental health brief on service delivery that we published 2 years ago. I've linked that here. We have a trauma-informed policy care brief that talks about trauma-informed policy, particularly during the COVID era. We actually have 2, I take that back, on addressing the needs of youth with disabilities with intersecting identities, or what we call intersectionality brief. We published one last year, and we just published a new one actually a few weeks ago. One's on program design, one's on program implementation. That talks about youth, with intersectionality, thinking about youth of color who have disabilities involved in foster care, child welfare, identify as LGBTQ, looking at all the intersect identities and what specific needs they have. And then our last one we have on justice involved youth with disabilities, looking at that specific intersection. We have one short brief out on that, and we're hoping I think we'll have 2 more by the end of the year, more in depth, coming out later this year. Again, those are all linked here, and happy to send those to you. And then Cape Youth has our general pages on mental health, COVID-19, and telehealth that we just updated earlier this year. And on our webpage, we have a program, policy, and COVID-19 scan. You can look up policies like legislation, executive orders, with programs, just general programs, nonprofit programs. And with the COVID-19 one, focus on COVID-19, but they all highlight policies, programs, and those things that are focused on helping youth and young adults transition to the workforce. And we have it divided up by state as well. So you can go into your state, Google certain terms to see what you have, basically. But yeah, if anyone emails me, I can totally walk you through that and show you how to do that. On our website, we have a webinar that also walks you through that. And we also have webinars on all these policy briefs and more on our website as well. Here are some links to things I mentioned for Mental Health America. I really suggest their workplace mental health toolkit, their BIPOC mental health things, and I mentioned their screening website to help screen for mental health conditions. Here I have some NYEC's resources. I really suggest reading the first one up there, their mental health report. Talked about that earlier, the survey they did. It's really in depth and it'll really break down much more the information I shared today. And here's my information and my colleague Yadine from Cornell. Again, she couldn't join today. She's the real expert in this field. She's a licensed social worker. But you can contact either of us, and here's capeyouth.org. All those Cape Youth things I shared earlier, they're all available on the website right here. If you have any questions, and they don't have to be Cape Youth related, my large organization CSG, we do all areas of public policy. We do research requests, TA requests. You just literally email me, or one of us give us a timeline and we can work on that. So again, that's really on any form of policy. If it's a Cape Youth thing, Cape Youth will do it, or I'll do it. And if not, I'll get it to the right team to do that. And then here for social media on Facebook and Twitter. And yeah, please feel free to contact me if you have any questions. And I guess we're kind of out of time, but if anyone has a last question or anything, I'll stay on for a sec. Thank you all for your time. I appreciate it.
Thank you so much, Abir. That was really powerful. And there's resonance in the chat regarding the ways you're uplifting cultural practices and supporting or building alliance with young people.
Thank you.
Yeah, thank you for that.
Oh.
So, folks are welcome to take a minute break and join us in the main room for our keynote beginning in just 1 minute. Thank you so much. And yes, if you have questions for Abir, please stay connected with him. Thank you for what you've shared.
Yes, thank you very much. I appreciate it.